So now we are going to discuss about the next content of the femoral triangle, and that is the femoral nerve. Before we discuss the femoral nerve, I just want you to get oriented towards the various muscles which are there in the front of thigh. Suppose this is the front of thigh, anterior superior iliac spine, pubic tubercle, inguinal ligament. This is lateral side, this is medial side, this is superior side, and this is inferior. We said that there is one muscle which runs like this, and the name of that muscle is sartorius. Okay? So there is this one muscle running like this, and the name of that muscle is sartorius. Above the sartorius, there are 4 muscles. Below the sartorius, there are 4 muscles in the front of thigh. So there is this rectus femoris muscle. Below the rectus femoris muscle is a muscle called as vastus intermedialis. Then there is vastus medialis, vastus lateralis. Vastus means straight. So there are basically 3 vasti in the thigh below the sartorius: vastus lateralis, vastus intermedialis, rectus femoris, and vastus medialis. Okay. Above the sartorius, there are 4 muscles. One is adductor longus, then is pectineus, then the next is psoas major, and the next is iliacus. Okay. So 4 muscles above are adductor longus, pectineus, psoas major, iliacus. 4 muscles below are rectus femoris and 3 vasti: vastus medialis, vastus intermedialis, and vastus lateralis. These are the 4 muscles which are responsible for extension of our knee. So while walking, running, these are the muscles which extend the knee. Okay. So many times all of you must be knowing that there is something called as a red muscle in our body, which has myoglobin, which sustained contraction happens in this. And there is something called as white muscle, which contracts very fast but gets fatigued very easily. This contracts very slow but does not get fatigued. So there are both type of fibers in these thigh muscles. In some people, there is 70% red muscle. So the red muscle characteristic is doesn't get fatigued but contracts slowly. So they are the ones who win the marathons. Then some people have 70% white muscle and 30% red. Okay. So those who have 70% red, 30% white, they win marathon. Those who have 70% white and 30% red, because they have 70% white muscle contracts faster but gets fatigued easily. They are the ones who win the 100-meter running race, 200-meter running race, relay race. But the 100-meter cannot win a marathon because the structure of the bodies is different. Indians cannot win any of them because Indians have 60% red, 40% white, or opposite, or sometimes opposite. Okay, so don't expect to win marathons and all those things. Okay, so again, talking about 4 muscles above, 4 muscles below, and most of these 8 muscles, almost 6 muscles. Okay. So 8, there are 9 muscles. Sartorius is also there. Sartorius plus 4 plus 4, 9. Of these 9 muscles, almost 7 muscles are supplied by the femoral nerve. With this background, let us start studying the femoral nerve. First point about femoral nerve is introduction. It is the largest branch of lumbar plexus. largest branch of lumbar plexus. Okay. Now you have come across this word lumbar plexus. We have already studied what is brachial plexus. So now first time we have come across the word lumbar plexus. So nerves of the lumbar and sacral plexus, they supply the lower limb, and the nerves of the brachial plexus supply the upper limb. Now for every nerve, whenever we write, we have to write the root value. What is the root value? The root value of the femoral nerve is L2, L3, L4. Now if you write this, you pass in it. But what we expect is more dorsal divisions of the anterior primary rami of L2, L3, L4. Now why dorsal divisions? Because dorsal divisions always supply the extensors. And all these vasti, rectus femoris, all these are the extensors of the knee. Okay, ventral divisions supply the plexus. In the upper limb also, all the dorsal divisions, they unite to form the radial nerve, and radial nerve supplies all the extensor muscles. Here the dorsal divisions are uniting to form femoral nerve, which is going to supply the extensor of the knee. So suppose we are looking from the side, this is the anterior part of the thigh, and these are the thigh muscles. So when they contract, they cause extension. When they contract, they cause extension. That is the extension of the knee joint. Okay. So femoral nerve. Okay. Now let us see the force of the. So this femoral nerve starts from L2, L3, L4 dorsal divisions. Now suppose this is the femoral nerve. The femoral nerve lies in the substance of the psoas major, lies in the substance of the psoas major muscle, doesn't supply it, and then emerges along its lateral border, and then it lies lateral to the psoas major. This we are talking about the course in abdomen. So abdominal course, it lies in substance of psoas major and then lies lateral to the psoas major. And then it enters the thigh by passing below the inguinal ligament. Enters the thigh by passing below the inguinal ligament. So this is the inguinal ligament. When I am drawing this, I should have ideally drawn the inguinal ligament like this. Okay, because this we are drawing for the left side. Okay. Enters the thigh by passing below the inguinal ligament. So suppose this is the inguinal, and there it gives two branches. One branch is branch to iliacus, and second branch is branch to pectineus. So these two branches are given before entering. So this branch to iliacus, branch to pectineus, these branches are given before entering the thigh, and after it enters the thigh, it lies lateral to the femoral artery and femoral vein. So femoral artery and femoral vein will be here. Okay. The vein is here and artery is here. So when it enters this, it is outside the femoral sheath. It is outside the femoral sheath. Okay? The femoral sheath, femoral canal is like this. Femoral sheath, femoral canal is like this. Is femoral canal. This is artery, this is vein, this is canal. Okay. Now this is more of a schematic diagram, and after it enters, immediately it divides into anterior and posterior branches. Divides into anterior and posterior branches, which are separated by lateral circumflex femoral artery. So femoral nerve, when it enters the femoral, um, when it enters the femoral triangle, it divides into anterior and posterior branches. I'll move on to the next page. So this is L1, L2, L3. From there, the femoral nerve has started. This is the psoas major muscle. Okay. Ideal to show, the reason I'm drawing this diagram is just ideal to show this as medial side and this as lateral side. When we define the sides, things becomes very easy. Medial side and lateral side, it is so lateral to the psoas major. Now I'm just correcting the diagram. This is anterior superior iliac spine, this is the pubic symphysis. And before crossing the inguinal ligament, it has given two branches. It has given two branches. Now to iliacus, and now to iliacus will be lateral, now to iliacus, and now to pectineus. Okay, and after entering here, it lies lateral to the femoral vein and artery. So artery will be here and the vein will be here. Artery will be here, vein will be here, the femoral canal is here, and all of them are in the femoral sheath. Femoral nerve is outside the femoral sheath, and after entering here, it immediately divides into anterior and posterior branches. Now it is very difficult to show anterior and posterior branches in a two-dimensional view. So let us call this as anterior and this as posterior branch. They are separated by lateral circumflex femoral artery branch of profunda femoris. Anterior branch is mostly cutaneous. So it gives two cutaneous branches, medial and intermediate cutaneous nerve of, and it gives one branch to a muscle, that is it supplies the sartorius. It supplies the sartorius. Anterior branch of the femoral nerve is mostly cutaneous, medial and intermediate cutaneous nerve, and supplies to a muscle, that is sartorius. While the posterior branch is mostly muscular, supplies the muscles. So it supplies the rectus femoris muscle. It supplies vastus medialis muscle. It supplies vastus intermedialis muscle. It supplies vastus lateralis muscle, and it continues down as saphenous nerve. Saphenous nerve, which is the longest cutaneous nerve in the body. Longest cutaneous nerve in the body. Okay, so in this diagram, this is the inguinal ligament. After immediately entering the femoral triangle, it is divided into anterior and posterior. The nerve to rectus femoris also supplies the hip joint. Nerve to vastus medialis also supplies the knee. Okay. So most of the branches of the posterior division are muscular: rectus femoris, vastus medialis, vastus intermedialis, vastus lateralis. So you see it is supplying 1, 2, 3, 4, 5, 6, 7 muscles. Of the 9 muscles which are there in the front of the thigh, 7 muscles are supplied by the femoral nerve. So when we talk about the branches, when we talk about branches of any nerve, now we are talking about femoral nerve, we remember the formula MACV. People use the word MACD for McDonald's. For remembering branches of any nerve, we use the formula MACV. So what is M? M is muscular branches. So what are the muscular branches? Anterior division supplies sartorius and posterior division supplies vastus intermedialis, vastus medialis, vastus lateralis, and rectus femoris. Also, it also supplies iliacus, the trunk. The trunk also supplies iliacus and pectineus. So these are the muscular branches. MACV, articular. Articular means the branches which supply the joints. So nerve to rectus femoris supplies the hip joint, because the rectus femoris crosses the hip joint. The nerve to rectus femoris also supplies the hip joint, and nerve to vastus medialis supplies the knee joint. Okay. Now here we have a same nerve supplying hip and knee. So if there is any pathology in the hip joint, the pain may be referred to the knee joint. So person may come saying that I have some pain in the knee joint. Natural problem may be in the hip joint, because the same nerve is supplying both the joints. Cutaneous. Okay. Now cutaneous supply, anterior division gives medial and intermediate cutaneous nerve of thigh, while the posterior division gives saphenous nerve. Saphenous. Fourth, vascular. What are the vascular branches? MACV. So what are vascular branches? To femoral artery and its branches. Okay, so these are the branches of femoral nerve. Muscular branches from the trunk to iliacus and pectineus. Anterior division supplies sartorius, posterior division supplies rectus femoris and 3 vasti. Articular branches to the joints. Articular branches are to the joint. Now to rectus femoris supplies hip joint. Now to vastus medialis supplies knee joint. Here comes applied anatomy. Pain of the hip may be referred to knee. Pain of the knee may be referred to hip, because it's the same nerve supplying. Medial and intermediate cutaneous nerve thigh from cutaneous, and saphenous nerve, longest cutaneous nerve, doesn't supply any part of the thigh. It supplies more of the leg and the medial border of foot. Vascular branches to the femoral artery. Talking about the applied anatomy. Applied anatomy of any nerve, we talk about the paralysis. What happens in the paralysis? So in case of injuries to the groin, the nerve may get damaged, and this can lead to paralysis of quadriceps femoris. What is quadriceps femoris? Quadriceps femoris is rectus femoris plus 4 vasti. Okay, and then along the medial border of the leg, there will be anesthesia because saphenous nerve is damaged, and also pain of the leg, the pain of the hip may be referred to knee, and vice versa, because it's the same nerve supplying both the joints. So that's all about the femoral nerve. So just a fast revision before I end the femoral nerve. Femoral nerve is formed by the dorsal division of L2, L3, L4. of the anterior primary of L2, L3, L4, largest branch of the lumbar plexus lies in the psoas major muscle force, then passes lateral to the psoas major, then enters the thigh by passing below the inguinal ligament. Before entering, supplies iliacus and pectineus. After entering, immediately divides into anterior and posterior division, separated by lateral circumflex femoral artery. Anterior division is mostly cutaneous, gives medial and intermediate cutaneous nerve thigh, and supplies the sartorius muscle. Posterior division is mostly muscular, supplies rectus femoris and the three vasti. Together they are called as quadriceps femoris. Seps means head, quadriceps means four heads. And now to rectus femoris also supplies the hip joint. Now to vastus medialis also supplies the knee joint. The branches are muscular, articular, cutaneous, and vascular. Okay. And in applied anatomy, pain of the hip may be referred to the knee, pain of the knee may be referred to the hip. So that's all about the femoral nerve.